Hi everyone, this is Dr. Suvrati Bansal. I'm a Urogynecology fellow in KMC Manipal. So I'm going to take you through the Bladder Diary today. It is an assessment tool very popular all over the world. It basically helps us understand the bladder or the urinary symptoms of a patient. For this tool to be effective, it is extremely important that the patient understands what needs to be done. And at the end of 3 days, usually she gives us a very elaborate document which helps us understand what she is going through, her symptoms, and her degree of bother. And it helps a urogynecologist understand and analyze what's wrong with her. It is a very effective tool, a very useful tool if she has completely understood what needs to be done. It is feasible if she has understood and she has the means to do it. It is a highly information providing or an informative tool. It is absolutely non-invasive, has to be entirely done by the patient, and it is totally free. And the information that it gives us, it can be priceless to us. So in the Bladder Diary, basically we need an input-output charting by the patient. Everything that she takes, food and fluid, has to be documented along with the time and the amount. And basically, after a lot of hue and cry, it has been decided that the most effective bladder diary would be the one in which the patient gives us the entire document of her 3 typical days of life, like 3 routine days of life. So the basic outline of the bladder diary is that for each of the parameters, you have to document the time at which they are taking place. The fluid intake should be charted according to the time. It is imperative that the patient should probably be drinking in a glass which has the measurement titrations. That would be ideal. Even the food that she takes she should be able to tell us the amount and the time for the bladder diary to be effective. And also, most importantly, her voids have to be measured and have to be timed. There is some extra information that also the bladder diary provides us with, which is the accidental leaks that she has, again the time and the amount. The activity that she was doing at the time of this accidental leak must be mentioned, and also urgency has to be documented. So for simplicity, it could just be a yes or no, whether she felt urgency or not. But if it is an elaborate or sophisticated bladder diary, you could actually grade the urgency as well. Here we've just given an example of a nice bladder diary which has all of these things: the fluid and the food intake, when she passed urine, and these 3 important things that we discussed: the accidental leaks, whether she felt the urgency, it's a fairly simple one, there's just yes or no, and also the activity that she was doing at the time of this leak. Things that we need to note through this bladder diary is her frequency through the day. Whether nocturia is present or not, she has to wake up more than once at night to pass urine. The maximum amount of urine that she has voided, like per void, and also the total amount of urine that she passes in 24 hours. It has to be equated with the amount of fluids that she takes through the day. With the help of this, we can figure out if there's any pathology, if there is any kind of incontinence. We can also see if there is urge incontinence, stress incontinence, mixed incontinence, the degree of symptoms, and the symptoms which are causing her the most bother, the degree of bother. So many things that we can pick up with the help of a bladder diary, if done effectively. Thank you.